This lecture addresses some GI topics that show up not only on step 1, but also on the Pediatrics Core Clerkship Shelf Exam, as well as step 2. Tracheoesophageal fistula, which can be abbreviated to TEF, is a fistula, which means an abnormal connection between two body parts, in particular between the windpipe, which we call the trachea, and the esophagus, which we could think of as the food pipe. Tracheoesophageal fistulas can allow extra air into the stomach. You inhale, then it goes in the trachea, and then it sidesteps using the fistula into the esophagus, and then it gets into the stomach. You can see this air as a prominent gastric bubble in the stomach on chest x-ray. If part of the baby's esophagus does not open up properly, we can call it esophageal atresia. This can go with tracheoesophageal fistula. In fact, some 85% of tracheoesophageal anomalies are esophageal atresia with distal tracheoesophageal fistula. And tracheoesophageal fistula is part of the Bacterial Association of Mesodermal Birth Defects. The L of the acronym is for limb defects. The C is for heart defects, C for cardiac. And we can say the T and E together are for tracheoesophageal anomalies. While there is such a thing as pure tracheoesophageal fistula, which looks like an H because there are two vertical tubes and one horizontal connecting fistula between them, we said the most common variant is esophageal atresia with distal tracheoesophageal fistula. Because of the esophageal atresia part of this esophageal atresia with distal TEF, the fetus cannot swallow amniotic fluid in utero. So the amniotic fluid builds up out there, resulting in polyhydramnios. Poly, too much, hydra, fluid, amnios, amniotic. So too much amniotic fluid. Maybe you learned this for MCAT. What germ layer do these come from? Bone, the wall of the gut tube, cardiovascular structures, tracheal cartilage, kidneys, muscle. Correct. Those are derived from mesoderm. So Bacterial Association is a bunch of mesodermal defects. We know the TE of bacterial is for the tracheo and esophageal of tracheoesophageal fistula. Do you remember what the L is for? It's limb defects. How about the C? That's cardiac defects. R is for renal defects, and V is for vertebral defects. Finally, A is for anal atresia or imperforate anus. One way you would use this information is when you examine a neonate, if you find they don't have an anus, you might do an ultrasound on the heart, which we just know as an echocardiogram. Imperforate anus might mean bacterial, which may include cardiac defects. What do you think happens at the first feeding to neonates with esophageal atresia with distal tracheoesophageal fistula? They drool, choke, and they vomit. Now, what is an NG tube? A nasogastric tube is for carrying food and medicine to the stomach through the nose. It has to travel the esophagus to get down there. And if a patient has esophageal atresia, whether it be pure esophageal atresia or esophageal atresia with distal tracheoesophageal fistula, if you try to pass a nasogastric tube into the stomach, it will fail because of the atresia blocking it. Now, patients without any of these anomalies will have some gas in the stomach. If the patient has tracheoesophageal fistula, whether it's pure tracheoesophageal fistula or esophageal atresia with distal tracheoesophageal fistula, this patient will have extra air in the stomach. What if we had pure esophageal atresia? In that case, chest x-ray would show a gasless stomach. The normal road from the mouth to the stomach did not open, and also we didn't get a made up TEF road either. Okay, let's tie it all up. The most common tracheoesophageal anomaly is esophageal atresia with distal tracheoesophageal fistula. This can be part of bacterial association, so that it would have a sort of a pleiotropic look with defects ranging from vertebral column to heart, kidneys, limbs, as well as possible imperforate anus. Again, the association of defects of bacterial, it's not random because they have in common the embryonic origin in the mesoderm. In utero, trouble swallowing can result in polyhydramnios, that is, too much amniotic fluid. The first time the baby tries to feed, you expect problems as the baby tries not to aspirate the breast milk or formula. And a clinical test, try passing a nasogastric tube into the stomach. If it gets a little down the throat but then encounters a blockage, that can be from the atresia in the esophagus. Finally, as long as there's a tracheoesophageal fistula, there will be a prominent gastric bubble, more air than usual. If there's actually no tracheoesophageal fistula and it's just an isolated esophageal atresia, there will actually be no gastric air at all. And no air means less than usual. Okay, that's it for this one.